If someone calls up in a panic and says that she just felt a lump in her breast, my first question always is, does it hurt? If the answer is yes, then I say good. Hello, welcome back to GynoInfo. Or if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we discuss common gynecological problems in a frank and open way that normal everyday women can understand without needing a medical dictionary. Recently, I did an episode about fibroids, non-cancerous lumps in the uterus, in the womb. Today, I want to talk with you about some other lumps, lumps in the breast, which one you should worry about and which one you can feel more relaxed about. Most women, when they feel a lump in their breast, immediately they think that they have a breast cancer and that they're going to die. Today's episode, therefore, is on a topic that causes many women an incredible amount of anxiety, which more often than not is completely unnecessary. But then there are also those women who should worry about their lump that they feel in, but they don't, or they're too scared to even think about it, let alone speak up about it, that by the time they finally say something, it's very much too late. These are the women who terrify me. I see both these things happen in my office all the time. And that is why we need to talk about it today. And you will need to talk about what you learned today with anyone who has breasts. And that includes men, because even men can get breast cancer. Breast lumps can be divided up several different ways. The most important of all is, of course, the division between benign, harmless lumps and those that are malignant, that are cancers. And then the harmless breast lumps can also split up between liquid, fluid filled cysts and solid, fleshy lumps, new growth, so-called tumors, but that are not cancerous tumors. As I explained in the fibroid episode, all that the word tumor really means is lump or growth, but not all so-called tumors are automatically malignant cancers. Most breast lumps are either harmless, solid, fleshy growths or fluid-filled cysts. Most so-called tumors are usually just a harmless lump, wherever they're found, not a cancer. Learning to recognize which breast lumps are most likely harmless and which one require immediate action is the goal of today's podcast. In my opinion, the most important point about breast lump is whether a lump hurts or whether it does not hurt. If someone calls up in a panic and says that she just felt a lump in her breast, my first question always is, does it hurt? If the answer is yes, then I say good, which generally comes as a surprise to my patients. But the fact is that most breast cancers do not hurt unless they are very big and about to rot through the skin where many nerve endings are located. But that is so rare to see nowadays. The only exception from this are so-called inflammatory breast cancers. They're a very rare form of breast cancer that grows very fast and makes the breast red and inflamed, looking more like an infection. But here too, almost all red, painful, inflamed areas in the breast, especially if you happen to be breastfeeding, are not going to be inflammatory breast cancers, but infections, mastitis, or sometimes a breast abscess. You can try to treat a breast infection with cold or hot compresses, but if it does not respond, meaning begin to get better and less painful over the space of 24 hours, you need to go to a clinic to be seen. But back to breast lumps. Most painful lumps in the breast are actually cysts that form during certain parts of the menstrual cycle in the week or two before your period. Cysts are fluid-filled areas in the breast that often come and go and generally disappear without any treatment whatsoever. Many women have them every month before their period. So my next question to the panicked woman on the phone will be, how long have you had this lump? Does it come and go? When was your last period? How big is the lump? Is it more like a cherry or more like a walnut or an apricot? These questions, of course, let you know that if you're young enough to still have periods, and you're most likely to have a breast lump that hurts, one that is a cyst, one that comes and goes and will end up going away by itself without any treatment. So you have a smaller than a walnut size but painful breast lump that you just noted in the week before your period for the first time, or that was there before your last period and then went away, only to come back again before the next period, or that you even had in the past, but that then went away while you're on birth control pills, but now has come back after you stopped the pill, then you can wait 1 or 2 menstrual cycles to see if this lump disappears on its own. Birth control pills actually protect you from these kind of cysts, so you don't feel them generally while you have birth control pill as your contraceptive method. Now, if this lump does not go away, I suggest that you show it to your doctor, whether it hurts or not. She can then make sure it's actually a cyst, and you and her can decide if it bothers you enough that you want to do something about it. This now brings me to the painful breast cysts that do not go away by themselves. These tend to generally be bigger, more the size of a walnut or even an apricot or more. Because of their size, there's a lot of pressure inside them. This pressure and even pain can only be relieved by sticking a needle into them and draining the fluid that's causing the pressure. This is most often done in the doctor's office. But of course, first your doctor needs to be sure that she's actually dealing with a cyst, a fluid-filled cyst, and not a fleshy lump. She can see if there is fluid inside with an ultrasound machine. And if it is a cyst that is big enough to bother you, she can then drain it just then and there. If it's not a fluid-filled cyst, it has to be dealt differently. I will discuss that later in this episode. Generally, the relief of the draining of the cyst is much bigger than the slight pain of sticking the needle in to drain the fluid through your skin, which is usually less than even somebody starting an IV in your arm. The only drawback of draining breast cysts is that often they fill up again with fluid and become painful again. You can drain them several times, and either they eventually stay away, or you and your doctor lose patience and decide to cut the cyst out in a small operation. The drawback of that operation is that a small scar is left in the breast, which, depending where the scar is located, is not something you want either. Even though most all breast cysts are benign, non-cancerous, most doctors will send cyst fluid that they remove to be examined in a lab to prove that there's nothing suspicious about it. If against all expectations there would be suspicious cells, the area in the breast with the cyst would have to be removed and the tissue examined further. Now let's talk about breast lumps that do not hurt. These are more worrisome because these kinds of lumps could be a cancer, especially in women older than 40 and definitely in someone past menopause. The older you are, the higher the risk that a painless breast lump will turn out to be a cancer. In women under 40, most breast lumps or breast tumors or breast masses, as they are called sometimes, even if they do not hurt, are not breast cancers. Less than 1 in 10 of all breast cancers are found in women under 40 years of age, but they tend to be very much worse and much more aggressive and harder to treat than breast cancers in older women. Very often, these kind of breast cancers happen in women who have a breast cancer genes, women that are born with a high risk of breast cancer passed down in their family, like Angelina Jolie, about whom I have talked in a different podcast. More than 2/3 of breast cancers, about 7 or 8 in 10 breast cancers, occur in women after they go through menopause, after their last period. The risk of breast cancer definitely gets higher the older you are, but the risk that you're actually going to die from breast cancer gets much lower with age. This is for 2 reasons. A breast cancer diagnosis is no longer an automatic death sentence. We now know that there are many different types of breast cancers that respond to different kinds of treatments that range from cutting them out with surgery, to killing them with radiation, to poisoning them with chemotherapy, to taking away their food with certain hormone treatments, and nowadays even to teaching the body's own immune system to go after cancer cells and kill them. There are many more different options that we can tailor-made to the specific cancer that we could separate out. The other reasons breast cancers are less deadly nowadays is that in many rich countries, breast cancers are now found and treated at earlier stages when there's a better chance for treatment to work. Women no longer have to die from breast cancer, but they die with breast cancer. The challenge in many women has become more how to manage the side effects of the treatment of these cancers than actually a question of just surviving the cancer, which of course is a good news and very encouraging. However, there's no time today to discuss the different kinds of breast cancers and their treatment in more details. Today, we're just talking about breast lumps in general and how to tell which ones you should be concerned about. Now, we're going to talk about breast lumps that do not hurt, but are not breast cancers and are also not fluid filled cysts that I discussed early in the podcast. These types of benign breast lumps are usually called fibroadenomas, benign, harmless tumors inside the breast that have fairly smooth borders like a marble. They're firm and can be pushed around. Some are a little bit more like chickpeas or garbanzo beans instead of a marble, and they do not move as easily and they're not as smooth, but they're not stuck to the tissues around them and they feel not hard and leathery like cancers. Fibroadenomas are made up of milk producing glands in the breast, the adenoma part, and the fibrous tissue around those glands, the fibro part in the word fibroadenoma. They also do not go on to develop into cancers, but they can grow, especially in pregnancy. To be absolutely sure that the lump you feel is not a cancer, you will need an ultrasound exam, possibly a mammogram, or even an MRI. And if there is any doubt about the diagnosis, a tiny amount of tissue will be removed in a biopsy from the inside of the lump with a very thin or possibly a thicker needle, depending who is doing the biopsy. This can be done by the radiologist or the gynecologist in the doctor's office, and you do not need a big surgery for that. The tiny bit of tissue will then be sent to the lab where the diagnosis can be made on what exact type of tumor you have, whether it's benign, harmless, or malignant and cancerous, or something in between. There are breast tumors that are completely benign and stay harmless, like the fibroadenomas I already discussed. But there are also other benign tumors that are not cancer, but sometimes can turn into cancers. They have the potential to become cancers. Some have more and some have less potential to turn into cancers, and some are already almost cancers, but not quite yet. Depending on how high the risk is for one of those breast tumors to develop into cancer and how willing a woman is to even tolerate such a risk, the woman and her doctor decide to remove her breast lump or just observe it closely and remove it only if it begins to grow or change. Removing it causes a scar, leaving it causes more or less anxiety, depending who you are. The chance that a lump a woman finds in her breast is going to be benign, harmless, is going to be higher the younger the woman is. As I already pointed out, only 1 in 10 breast cancers are found in women under 40, and in women under 30, they are even rarer, though over the last few years, breast cancers in women that are young have been increasing faster than in women after menopause. This increase in breast cancer overall, actually, in most, if not all cancer, most likely has to do with pollution and what we're doing to our environment. The absolute most important thing I want you to learn from this episode today is that if a breast lump does not hurt, please, please, please do make a doctor's appointment right away. It may not be cancer, most likely it is not, especially if you're under 40, but it could be. You do not need to go to an emergency room, but this is definitely the time to tell the receptionist on the phone that you have a hard breast lump that does not hurt and that you're worried that it is a cancer. And if you have women in your family with breast cancer, say that too. Please don't be that woman who, when she feels the typical hard lump in her breast that is stuck and cannot be moved around, and when I ask if she didn't feel that, says, "Oh, yes, I did feel it for a while, but it didn't hurt, so I decided to wait for my next checkup." That for a while often turns out to be more than a year, and the painless lump is confirmed to be a cancer, and it is already far advanced and has spread far and wide. The chances are then still very high that this woman will not die from it, but she will have to endure much more treatment than if she had spoken up earlier. So if a lump doesn't hurt, please do take it seriously. This brings us to the end of this episode. I hope you liked it and it gave you a lot of information that is useful to you or your friends. And if you have any further questions about breast lumps or any other topic having to do with women's health, please don't hesitate to send them to me at questions at gynoinfo.net. Again, that's questions at gynoinfo.net. And if you like this episode, please give us a lot of likes and share it around. And above all, again, please tell all the women you know that breast lumps that do not hurt can be much worse than the ones that do hurt. It would also be super nice if you would subscribe to GynoInfo because it helps Josh and me to keep this podcast going. Thank you. Until next time, thank you for listening, and remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at GynoInfo and on LinkedIn at GynoInfo Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.